understand how electricity affects the body, we need to understand a little bit about electricity and how it works. Electricity is the movement of an electrical charge, specifically the movement of particles with a negative charge called electrons. This movement of electrons is called an electrical current. Electrons flow from an area of negative charge to positive charge. The wires for an electrical stimulation machine are color-coded to more easily identify the positive and negative polarity. The black cable is the negative pole and the red cable is the positive pole of the circuit. These are some important terms related to electricity. Voltage. This is the potential energy difference between 2 points that is measured in a unit called volts. Think of this as the amount of electrical force that pushes the current along the circuit, like water pressure in a hose. There's a lot of pressure at the start of the hose that, when released, will move the water through the hose where there is less water pressure. Current. This is how much charge is moving, flowing through the circuit in a period of time. This is measured in a unit called amps. When providing electrical stimulation during rehabilitation treatment, the current levels are measured in smaller units called a milliamp or mA. The higher the milliamps, the more charge is flowing through a circuit. Think of this as how fast the water is flowing through the hose. Resistance. This is how difficult it is for electricity to follow along a circuit. Think of this as the size of the hose. The larger the diameter, the easier it is for water to flow through the hose, having less resistance. With a small hose, it's harder for the water to flow through, having more resistance. When providing electrical stimulation as part of a treatment, resistance occurs when trying to get the electrical charge into the skin and into the body's tissues. The machines used to provide electrical stimulation as part of a rehabilitation program use one of two types of currents: alternating and direct current. The first type of current we will discuss is called alternating current, or AC. Here's what it looks like when drawn as a diagram. With this type of current, the current flows first in one direction, then changes in flow in the opposite direction. Electrical stimulation using alternating current is used for pain management, muscle re-education, and strengthening in muscles where the nerves are working. The displayed image is called an example of alternating current. The features of the current can be changed to get the needed response in the body. Pulse is a burst of electricity. This includes the positive and negative current. Pulse duration, also called pulse width, is how long it takes to complete one pulse. This is measured in microseconds. Interpulse interval is the amount of time between consecutive pulses. Phase is either the positive or negative part of a waveform, indicating there is electrical activity. Phase duration is the amount of time it takes to complete one phase of a pulse. This is measured in microseconds. Interphase interval is the time between two consecutive phases. There is no electrical activity occurring at this time. This is measured in microseconds also. Amplitude is the measurement of strength of current or voltage through the circuit and can also be called the pulse intensity. Frequency is the number of pulses of electricity per second, which is also called the pulse rate. This is measured in a unit called Hertz, or Hz. Remember, we previously learned that a higher frequency is used for sensory stimulation for short duration pain relief, while a lower frequency is used for motor stimulation or long-lasting pain relief. Rise time is the time it takes to go from no electricity to the strongest amplitude. And decay time is the time it takes to go from the strongest amplitude to no current. The waveform we've just reviewed is called symmetrical. This means that each of the wave features are the same each time the current is on. There are other waveforms that are asymmetrical. This is when the second half of the waveform does not mirror the first half. Here's an example of an asymmetrical waveform. The other type of current used to provide electrical stimulation as part of a rehabilitation program is direct current, or DC. The electrical current only flows in one direction with either a positive charge or a negative charge. Direct current is used for wound healing, decreasing edema, and getting muscle contractions for muscles where the nerve may or may not be working. The rehabilitation therapist will provide the treatment settings for the electrical stimulation treatment. However, we need to provide feedback to the rehabilitation therapist about the patient's response to treatment. If we are not seeing the expected response, for example, a muscle contraction, the settings may need to be adjusted. Other reasons to adjust the settings include the patient comfort and preventing the body from becoming used to the stimulation. This is called accommodation. For example, people who live near a railroad track stop noticing the sound of the trains as they go by. Similarly, the body can start to ignore electrical stimulation if it is not changed, which will decrease the overall potential benefits of the treatment. If we are using electrical stimulation to help the muscles contract, just like with exercise, the muscles can get tired. When stimulating muscles, we need to think about how quickly the contraction will occur. Allowing time for the muscles to contract at least 2 seconds is a more comfortable contraction for the patient and helps the muscles work in a more normal way. Some of the settings that can be changed include the amplitude or the strength of the current, also called intensity. Think of this as how high the machine is turned up. This will vary for each patient. Frequency, the pulses of current per second. Think of this as high and low frequency, muscle or sensory stimulation. Ramp time. This is used mostly for muscle contraction for strengthening. The time it takes to reach maximal amplitude or maximal contraction in the tissues. Duration, the length of time the current is on, including the ramp time. This is the number of pulses happening each second. The on-off cycle. This is important when using stimulation for muscle strengthening. This is how long the stimulation is being applied and how long a rest period is provided before the next stimulation begins. It's important when using electrical stimulation for muscle strengthening to document the on-off times as part of the treatment settings. The usual ratio for muscle strengthening is 1 second of contraction for every 5 seconds of rest. So for example, if the on time was 5 seconds, the off time should be 25 seconds. For strengthening, we want to consider having the stimulation set so the patient is performing 10 to 15 contractions. If the goal is to relax the muscle, then we want to give the muscle less time between contractions so the patient would have 20 to 30 contractions.